Hello, good evening. You are watching my YouTube channel. I'm your host, kamranarshad. Today, I've invited a guest in my vlog, and I'm going to discuss about her life, her goals, her visions, and most importantly, her field as well. Welcome, Afrah Arshad, licensed clinical psychologist and esteemed student counselor at Lens. Today, we have the privilege of delving into your expertise and gaining insights into the crucial role you play in supporting the well-being of students. To begin, could you share a bit about your background and journey into the field of counseling, ma'am? Over to you.
Assalamu alaikum, and thank you so
Walaikum
much
salam.
for having me over. My name is Afrah, and I'm a clinical and counseling psychologist. I've done my master's from Beacon House National University in 2021 in clinical and counseling psychology. I believe that I'm a very competent, compassionate counseling psychologist with extensive experience in mental health and well-being. I have been working in providing therapy sessions since more than 5 years, and my area of expertise is in adolescence counseling with effective communication and solution-oriented approach. I also work with children, but I'm working at LUMS as a student counselor as well. So we are just with adults right now, not with the children.
That's great. That's great, Miss Afra. Okay, tell us about, tell us something what people don't know about you.
As a psychologist, I think that my main focus during the therapy is on the client. I do not follow what is written on the books. I do not follow the basic practical approach in the therapy sessions. Make the I try to give the comfort zone to my clients. I try to focus to have my therapy this client focused approach. And whatever they are more comfortable in, and however they want to, initiate the conversation with me, मेरा main focus है ना वो clients की तरफ ही होता है.
That's great. That's great. And how did you get into this?
How do I get into this?
Yeah.
Well, I focus on the needs of the individuals. What are their needs? What are their experiences? And what is the perspective of that experience? Because I believe that most of the traumatic events or most of the incidents that every individual experience is somehow similar to each other, that results into anxiety and depression. But the main part is that what is their perspective towards it? How do they see that incident, and how did they experience that incident? Which of course one incident leads to having different thoughts, different emotions, and sometimes they are not similar to each other. So that's how my therapy approach begins, with their needs, their emotions, and their thoughts.
Okay, Mr. Afra, actually, how can a person get out from anxiety or depression if someone finds that he has anxiety or depression with any reason? There can be so many reasons behind that. But if he comes to you and asks you that, I have this kind of scenario, and how did you find out that he has anxiety or a depression? And can a person get out from these things?
All right. Thank you for asking that question. Yes, anxiety and depression, you can come out of these things. They are not for life. And when they comes to me, if they are already aware about their symptoms, then obviously it gets easy for me
through medicine
work
or through counseling?
Yes.
Through medicine or through counseling?
Through counseling. I am a psychologist, so my main focus is on the counseling. We do not provide medicines unless we are licensed to do so. Okay, so that's also very important to clear that. A psychologist cannot prescribe you medicines. That comes under the category of psychiatrist. And obviously a psychiatrist is a doctor. They have done MBBS, and that's completely a different field. So I focus on the counseling. And the counseling is all about having a conversation with the client. It's all about how are you going to let the client open up to you.
Right.
When a client comes to me, as I was saying, when a client comes to me, and if he is already aware about the symptoms, then obviously it gets easy for me. I just have to work on the strategies, and I have to, tell the person different techniques and exercises that how he can work on the anxiety or depression. But sometimes they're not familiar. They're not aware of it. They're not sure that what is happening to them. So for that, we do have assessments. We have formal assessments as well. That helps us to easily identify, they can rank their emotions or feelings from 1 to 5. Like, I don't feel like doing anything. I've lost my appetite. I don't enjoy things that I used to enjoy anymore. So these are different types of questions that comes under the formal assessments. But it's also important that you have to observe the client as well, because sometimes the formal assessment do not says what the behavior of the person is saying. So we also have to focus on the behavior of the client as well. We have to observe that. Coming to the question that how they can come out of it, is that it's not only about how do they feel, because it's easy for a client to share their feelings that I'm feeling scared, I'm feeling anxious, I'm feeling like I don't want to go to that place. Suppose a person comes with the social anxiety and he says that I don't like to socialize with people. Right? Why do you not like to socialize with people? Because if I socialize with people, it makes me feel less confident. It makes me feel scared about. They
They
can
feel
easily
that they are
identify.
introvert, right?
Yes, they can identify that. But as a psychologist, sir, our job is to extract the thoughts behind those feelings. What are they thinking? What are their thoughts that is making them feel like that?
Okay.
And the thought, I will also like to share some examples that if a client says that I do not like to socialize with people, why do you not like to socialize with people? Because I think that if I talk to them, they might make fun of me. Because I feel like I do not know how to start a conversation.
All right.
I feel I'm less confident. I feel I am, I cannot talk properly. So these are the thoughts that makes them feel anxious.
All right, all right. And how long have you been doing this? And what is the age bracket of your patients? The patients
Yeah. So
that.
as I said that my expertise is in the adolescence that comes under the age of 14 till 20,
Acha,
the adolescence
14.
category. But
Okay.
yes, it starts with the age of 14 till 20, 21, 22
Don't you
teenage
think it's
teenage
an
period.
alarming situation for our society or the people at 14-year-old
Yes, yes,
patients?
definitely. Sir, if I talk about children, they are not having just issues with their writing, with their reading, that the student or the child, they are not behaving properly. These are not the only problems children are having. They're also going through depression. Children have issues like they cannot sleep at night. They are having nightmares.
Yeah.
Some are not able to eat properly. What is
They're
the
having a
reason behind?
mobile phone as well. It's a disease,
Yes,
actually. We can
definitely,
say that, actually.
because it's important that we have a healthy routine overall, right? Exercise is not just yeah, you wake up early in the morning and
Actually,
then
ma'am,
there's no
they
more.
are just watching porn movies. They have a bad habits. They have a bad gathering, so it affects a lot. I think so. What do you say? What do you
Definitely,
think?
sir, social media
Yeah,
and awareness and approach to these things, they
exactly.
are never for the children. They are never for the children.
Because everything is on a one click, right? This is the
Yes, yes,
main thing, actually.
definitely,
Okay, fine.
definitely.
I got your point. Actually, okay. As a licensed clinical psychologist and student counselor at times, how do you approach counseling to address the unique needs and challenges of students? Can you share insight into your counseling philosophy?
Definitely, sir. As I said that I try to have a person-centered therapy, that my focus is on what is the basic purpose behind coming to the therapist. Why are you here? What are your goals? What are you looking out of this?
Right.
And the most important question that I ask them, that when once we are done with the therapy, that takes about 45 minutes to almost 60 minutes. Okay. So when they are done with the session and when you leave the room, what are you expecting out? What do you like? What do you look into this? How is this going to change you? Are you looking to work on your emotions? Are you looking to work on your thoughts? Is it your behaviors? Is it your relationship problems? Or you have, what are you looking at? That's
Right.
the main initial questions that I ask my clients.
All right.
And once I have those goals, those needs, I try to, tailor strategies according to those needs.
Right.
Because if I have the needs, it's very easy for me to work on the interventions. Because
Okay.
if I don't know why are you here, right, and
Mhm.
I'm making interventions or I'm making treatment plans that focuses on something else, there
Right.
will be no outcome.
Mhm.
Because I'm working, suppose they are here because they want me to work on their self-esteem. And
Mhm.
I'm making strategies that is focusing on, how to wake up early in the morning and how to not procrastinate. So obviously they are not interlinked. So I
Mhm.
have to make sure that I'm aware of their needs so that I can work on their interventions as well.
Okay, that's great.
I
After,
also have to make sure that
sure.
whenever a client comes to me,
Mhm.
the environment,
Mhm.
the environment that I provide them is non-judgmental. Because if I start judging them, then there will be no difference between me and the people outside the world.
Actually, this is
I
a
have to make
drawback
sure
of us.
that, I'm
We
being
judge the
very
people,
non-judgmental.
right? If we are the patients or not a patient, it's a
Yeah.
society dilemma that we judge the people.
Yes, yes.
And we make that statement that he is not
We
a
are
good
just,
man,
we
he
are
is not
humans.
a, yeah, exactly. This is actually the thing we need to address.